So now we're going to talk about chronic obstructive pulmonary diseases. We're going to compare two types that are very irreversible, right? So meaning that once you get it, usually you have it for the rest of your life. So the first is chronic bronchitis. So chronic bronchitis is a condition where you have excessive coughing over a 3-month period in a at least consecutive 2 years, right? So you cough for 3 months. For next year, you cough again for 3 months again, and then you usually are diagnosed with chronic bronchitis due to the inflammation of your bronchus, okay, or your bronchi. Emphysema, on the other hand, is usually diagnosed later, right? So you have both of these are a result of excessive smoking, right? A lot of allergens, etc. But smoking is usually the cause of both of these, chronic bronchitis and emphysema. And emphysema usually is the hyperdilation of your alveoli, right? And so this hyperdilation leads to an increase in compliance of your alveoli, which leads to respiratory abnormalities later on in the future. So when we look at chronic bronchitis, so one thing that's really very obvious in order to distinguish between the two is most people that have chronic bronchitis are usually obese, so obesity can lead to it. Cyanosis, so people having excessive color of blue, so cyanosis, obesity, so people that are abnormally large, whether it's diet related or genetic related, etc. These patients also have an elevated level of hemoglobin because they have experiences of hypoxia, right? These patients have elevated hemoglobin levels that are present here. Okay, and let's see what else. And so another thing that's really important too is they experience systemic edema. Systemic edema, so they have excessive fluid that is being seeped out into throughout their systemic circuit, right? And so these patients, the way they're diagnosed too is through using stethoscopes to monitor for wheezing. Wheezing and excessive coughing will be usually a good indicator of chronic bronchitis. Okay. However, emphysema usually is the older patients. Obstruction of the alveoli, as we mentioned before. They have severe dyspnea. So what does dyspnea mean? Dyspnea means difficulty breathing, even eventually leads to apnea if not treated rarely, right? And so in the actual X-ray, you can actually see if some kind of radiographic technology is used, right? So X-rays can be used. You can actually see this hyperinflation in their diaphragm. So their diaphragm becomes very hyperinflamed, and you can actually see this based off of that. So if we were able to write some conditions here, so you have dyspnea, you have usually in the older age, during X-rays, you can actually see their hypercontraction. Right, so there's hyperinflation with the flattened, if we remember from inspiration, that the diaphragm flattens in order for inspiration, right? So they're in a very high inspiratory process, right? So they have a very flat diaphragm from their X-rays. Diaphragm. What else? So when we look at others, and so we have dyspnea, age, what else? Quiet chest, so they have a quiet chest, so their chest don't make really sounds whenever they use a stethoscope to measure. And also, if you remember the physiological tests that we use, they have a very, very low, the forced expiratory volume to forced vital capacity ratio. So that's less than 8.8. So it's less than 0.8. So it's around less than 0.8. And this usually is a comparison between the two chronic obstructive diseases. So what's really important to remember, both of these are irreversible, right? So usually whenever this happens, there's no therapies out there to allow for this reversibility to take place. There are instances where these patients can have a remission in their symptoms. However, a lot of stimulus can cause these symptoms to return back, based off of the actual condition, the time, the onset, and the vulnerability.